of Medicine has a strong commitment to training doctors to work in areas of unmet need, particularly in the vast rural and remote areas of Australia. The Kimberley Remote Area Health Learning Week is part of this commitment to ensuring that our graduates understand the challenges of rural and remote medicine and hopefully spark a bit of interest for them to explore working in these areas. I think the Kimberley Area Health Learning Week that our students in their year 2 of our program in Fremantle have just completed is part of a strong continual curriculum through our school that echoes our commitment to rural and remote health.
This year we weren't able to take our second year medical students to the Kimberley, so we tried to bring the Kimberley to Fremantle, or as much as what we could.
Silver paperback or silver tea tree.
I found it really valuable. Elders from the communities, learning about bush medicine and all the good things that come with that. I thought it was really worthwhile.
It is important for medical students to use our services, and it's going to work both ways for clients, patients, and doctors and nurses, that to understand one another more clearly.
Having worked in the Kimberley before, I thought I knew everything that there was to know about working in the region. However, after the Kimberley week at Notre Dame, I thoroughly wish that I had learnt some of these things before I had actually worked there.
The highlight for me was the presentation we got to do, and we had a lot of people who came in who had experience of going to the Kimberley and living in regional Australia, who gave us a lot of feedback.
Medical students' desires to go and work rurally exists on a bell curve. On one end, we've got the students who are always going to go work rurally and are inspired already, and the Kimberley and this week fuels that fire. In the middle, we've got the students who are pre-contemplative, thinking about an opportunity in rural health or pursuing new opportunities. And on the other end, we have students who have no desire whatsoever to go work rurally, but they play an important role in improving the healthcare that we provide to our patients. The Kimberley Immersion Week is an important role in inspiring junior doctors, or future junior doctors I should say, to improving healthcare for people both in the city and in the country.
We appreciated the doctors that came and spent time with us in our CD groups and spoke to us about their experience and the challenges that they have and the privilege that they have working out in the Kimberley regions, and the doctor we had was from Derby, and it really inspired me to continue my pursuit to want to go into rural medicine.
It's really important for junior doctors and medical students for lots of reasons. There's the obvious reason of hearing about experiences and things for the first time with a plan to maybe go to the Kimberley or go to a rural area. Actually, for those students that probably won't go to rural areas or remote areas and who want to specialise or work in tertiary hospitals or work outside of rural health, to actually still have an understanding, because at the end of the day, even if you specialise, whatever specialty you do, you're still going to get rural patients referred to you. It's often found back in the early days was that the tertiary hospitals didn't understand where these people were coming from and the logistics.
The PBL case that Donna designed for us to do over 2 weeks put into the picture how holistic medicine can be and how a real patient could present to us with a lot of different determinants of health and considerations that we as future doctors have to think about. I also really loved learning about the different promotional health programs and ads that they made for Aboriginal kids and people with different cultural backgrounds and linguistic diversities. I've never seen anything like that, and the combination between languages like Creole and English and using visual representations to promote health was amazing. And I think as doctors in the future, it'll be awesome to learn how we can integrate that into our own clinical practice.
I think by taking part in a Kimberley Immersion Week or learning about the significant challenges faced by people in remote environments and regional communities, we have the opportunity to learn about what's important for us to advocate for.
So I started my medical journey at Notre Dame many years ago and have been involved in the Wheatbelt and Kimberley placements, which was such a valuable experience and has led to, I guess, my career journey to date. I've spent lots of time all over WA, more recently living in Derby, and I'm the Senior Medical Officer of the Derby Aboriginal Health Service. And although I now work remotely and fly back and forth, I still have that connection and I value that, and I think the experience has made me a better person and a better doctor.
Having been a GP and public health physician and supervising medical students and being a medical coordinator for Royal Clinical School, really in the last few years, you can really see the difference in Notre Dame students, that when they come to you, they've been taught so much about country practice, about working in rural WA, about Aboriginal health, about policy, about Aboriginal community control, and it's so amazing to see. And I think a major part of that is that experience they get being immersed in the Kimberley and in the lifestyle, in the place and the people. So while it's so disappointing the students weren't able to do that this year, it's been really great to spend time with them here at Notre Dame. They've been so engaged in the discussions and have so many questions about what it's like to work in the Kimberley. And I'm really grateful to be able to share what it's like to work at an Aboriginal community controlled health service, because we really need these med students from WA to come and work in our communities and work in our ARCHOs, so that we can have a really strong and sustainable workforce that is culturally safe and understands the complexities for patients living in rural Australia and also for Aboriginal and Torres Strait Islander people.